Is there anything that you find yourself doing because of how much you were hurt, because of how much anxiety you had?
Well, I think one of the saving graces of being an osteopath in Canada is that I can't diagnose. So that automatically sort of strips me of those heavy, heavy words. And when I find something that I think might be in that realm,
Mhm.
I'll usually send them potentially to someone else so they can get that box checked, which it sort of allows me to always take a step back and know that I'm potentially not, laying down the law with like it's black and white. And I put a lot of onus on my clients of like, how does that feel? Or, when I say there's the potential that you could be looking at this sort of dysfunction or maybe getting blood work to rule out some of these things, how does that feel? Like I'm checking in with them because that I think is sometimes what's missing. It is like the connection to someone's feelings in this experience. We can just look at the physical body of like, oh, well, you've got a torn supraspinatus. Can almost guarantee, But like,
Mhm.
how does that feel? Like that's crushing for people to be like,
Sure.
I've done this to myself,
Yeah.
I and then I'm always trying to bring it back to like, look, I see this all of the time, or I've experienced myself. And sadly, a lot of times I have experienced a lot of things myself. And I think that it just brings it back to normal of like, don't worry, this isn't you failing your body. This isn't like something that's super unique and abnormal. I see it quite often. It's common. And let's maybe explore some of the reasons why it's happening.
Yeah. Yeah, that is interesting because I've as a chiro, like, I've had people come in and they go, oh, I had an x-ray like 10 years ago and I have degenerative joint disease.
Oh,
And you're like, I have gray hair and everybody I know my age has gray hair. And that, like to us, it's nothing, but to them, they think that that will define them for the rest of their life, you know,
yeah.
or, or I think blood work's a perfect example because some people think of that needle going into their arm as like the end. Like this is the start of the end. And some people are like, no, I have blood work every 90 days. I just want to know what's going on. I'm just checking my hormone levels or I'm just checking whatever. And then, it's interesting how we interpret things. I'll tell you a funny story. I had a friend who, when she was like in her late 30s, she went through a battle with breast cancer and she was successful, but she said her daughter was like 5 or 6 at the time. And one day her daughter woke up and was sick and her daughter went to the bathroom and threw up and came running out like, Mommy, guess what? I just threw up like you. Because my friend had thrown up so many times from chemo and the daughter perceived it as like a step in growth. I know I've thrown up. Like I learned to walk, I learned to talk, I learned to throw up. And it was such a learning experience for my friend because she was like, you don't think but what else would a kid think? Like that's what adults do, right? They drive the car, they throw up in the toilet and all these things. And she was sad, but also her daughter has never ever thought of throwing up as like a bad thing. It's just a normal part of waking up and brushing your teeth. We can have that perception about things.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust Driven Insights, real conversations, smarter care, stronger business.